Fraud, waste and abuse is not only a South African problem, it's a global problem. You see that in the environments such as banking, in insurance and in the medical aid environment. And unfortunately South Africa is no exception. So we see collusion between healthcare practitioners and members to defraud schemes, etc. But I want to emphasize that the majority of healthcare practitioners and members do things responsibly, and this is a small number of people that abuse the process. Having said that though, the size and scale of the problem is significant. The Board of Healthcare Funders has indicated that on an annual basis, almost 22 billion rand is wasted on fraud, waste and abuse.
With that scale of damage, are we not at all worried that it may translate and extend to the national health insurance?
I think that's a very important and necessary concern that you raise, but therefore, as we move towards national health insurance, it's important that the right governance structures are in place and also the procurement process are well implemented to protect the national health insurance process from these abuses.
That was our reporter, Sintling Lihihi, speaking to the Government Employees Medical Aid Scheme a little bit earlier on. She joins us now live from Sun City near Rustenburg to give us a little bit more on that conference that's taking place. Thanks very much for joining us, Sintling. Thank you. Give us a little bit more about what played out today.
An absolute pleasure, Peter, and evening to our viewers. It's the third day of the 19th Annual Board of Healthcare Funders Conference here, of Southern Africa Conference here in Sun City. As you have mentioned, the discussions have been quite wide and very interesting. We've heard about talks about ensuring that the adoption of the national health insurance does not leave anyone behind, particularly talking about gender issues, including making sure that women are well included. But the most topical of issues comes from this problem of fraud, waste and corruption, where the report by the BHF has exposed that over 22 billion is wasted annually on fraud and corruption in the medical aid schemes. Next to me, I've got Dr. Nhlapo from the HFMU. Doc, what are we finding to be the most pressing issues when it comes to fraud, waste and corruption in medical aid schemes?
I think I must just begin by saying it's something that we've just realized and we're working on it, and what actually brings the numbers to where they are, it's member education. We lack in member education. People feel entitled to the benefits. So, I mean, if you are paying your premium every month and you don't go to your doctor, you find yourself, or you think you are shortchanged. So you'll find every reason to make use of your medical aid card, including soliciting money in lieu of fraudulent or treatment that was never rendered.
But it's not only those who seek healthcare intervention, but those who are also healthcare practitioners in themselves, who find themselves in the wrong.
Yes, I mean the biggest issue that we find within the medical aid industry today is the fact that there's a lot of collusion between service providers and the members of medical schemes. People make arrangements, a doctor make arrangements with a member, or in the main is the member that goes to the doctor to ask for favors. And doctors being doctors, I mean, I don't know whether we've got soft hearts for our clients or members or patients. We end up, doing what the members ask us to do, forgetting that we really, what we're doing is against the very same Hippocratic oath that we signed when we qualified as medical practitioners.
This illegality does not only affect South Africa in isolation, it's an international problem. We've seen you engaging with other stakeholders from as far as field of the USA, talking about how they're losing over 3.3 trillion to this illicitness. How will we then ensure that in these engagements as South Africans with our international counterparts, we counter this from affecting our national health insurance in the long run?
I think it has come to our realization as healthcare funders, the issue of collaboration, sharing information at all costs in spite of all terror. Because, I mean, that's the only way you're going to fight the scourge and win it. You must share information, collaborate, share notes. That's the only way you'll stop or you'll nip the scourge of fraud.
Now, in your engagements with all the stakeholders, there's an interesting commitment that has been made. Tell us more about what you and all the stakeholders have been committed to do to counter this fraud and corruption.
What BHF has done, I mean, as recent as the last week of May, we launched a portal. The launching of this portal is going to make it possible for all, member schemes within BHF to share information. Everything that we do will be put into this portal that will be available to all member schemes, so that everyone sees who and what is doing what at any time at any time during the processes.
So you will have the hawk's eye on them at all times? At
all times, as well as, I think the other issue that is most important is the fact that the Special Investigation Unit, the national SIU in our country, has realized the health sector forum. They've just been established now. They're going to be working with Council for Medical Schemes, the Health Professions Council, BHF, ourselves, and HFMU. We're going to work as a team to fight the scourge, both in public and private sector.
Thank you very much, Dr. Nhlapo. With that clearly said that there's nowhere to hide for all those who practice fraud and corruption. Back to you guys in studio.
St. Ling, thank you very much indeed.